Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back. And if you're joining us now, we're getting our second conversation for this morning started. And we're shifting gears a bit. We have our COVID-19 update, and we're going to be breaking down some of the latest figures from the COVID-19 pandemic in Belize. And joining us, we have Dr. Francis Morey, who is the Deputy Director of Health Services, Ministry of Health and Wellness. Good morning, Dr. Morey.
Good morning, everyone, and thanks for the invite. I think it's been asked before, but I've been somewhat kind of busy. Nonetheless, we're making time out to be a part of this session.
Well, of course, I could imagine how busy, especially considering the topic that we're discussing this morning. But so we're talking about some statistics that have been compiled in relation to the effects of COVID-19 in Belize. Can we talk, first of all, a little bit about how data was compiled and if these numbers are from the beginning, so to speak, of the pandemic?
Yes, certainly. Yeah, what the Ministry of Health does, it has various it picked up data or information from various areas. This includes the private sector, it includes the public sector, and by this we're referring to that tests that are done at the health facilities or COVID units, the different testing areas, for example, the drive-thrus, and the laboratory and at the central medical lab, and our partners with the private sector and those do testing in the community. So there's various areas of where this information comes from. It's collected, collated, and then my colleagues at the PUDIN, they have the access to data from the BHIS, which is the Belize Health Information System, and from then they put it into various infographics that you see that we are presented on a daily basis. So on a whole, it's very close to what might be the true scenario in our country. And by this I'm saying is, look, we are cognizant that there are some persons who don't come to get tested, some persons who are asymptomatic, and they certainly don't visit our facilities because they don't have symptoms. And so for every case that you have a person testing positive, you may have X amount of persons who are out there who are positive and are acting as carriers, and they're not we don't get them into our data, our daily data, because they don't access services. So that's an X factor that we also have to deal with. Nonetheless, the data that I have that we may have there, I have the information from yesterday that was presented, and we're talking that as of to now, as of when the first case came into country, we have done approximately 321,000 tests, of which 308,000 persons have been tested. Of this, we have 28,162 persons have tested positive. 25,511 have been recovered, and as such, we're talking about this possibility, this figure. It's just an estimate. And those who have recovered falls into that scenario of persons who have been critically ill, those who have been hospitalized in our various ICU units, whether the private sector or the public sector. We're talking about the persons who have been mildly infected, and of course we give them at the 14-day period, we give them medical clearance. Also, those who have been moderately affected, and so we're talking about those who have been recovered at various stages of the disease. Those who have had hospitalization within ICU units, who have been infected and spent various up to 2 or 3 weeks within our facilities, and so this is what we're talking about recover. So we're also talking about as up to now, we're talking about 509 deaths that we've seen within our facilities. This includes male and females, and this includes persons who have been hospitalized in Corozal, Orange Walk, Belmopan, San Ignacio, across the country, and even within the private sector. So that's the amount of persons who have passed away. And the fatality rate is 1.81, which means that out of the total persons who have tested positive, that's the calculation that we get there. As of yesterday, we've had 28 hospitalizations, and we've had 10 ICU admissions. So this is what the ICU would refer to as the persons who are being hospitalized at KHMH. We have a small moderate care unit at Belmopan also that we are able to house these persons who are moderate to critically ill, not the severely ill. And by severely ill, I mean those who actually need to go on a assisted respiratory equipment, a ventilator. We're able to do that now at Belmopan. We've built some capacities. We continue building capacity in our physicians who are there, mostly the internists and some medical officers, some nurses who have received some level of capacity in dealing with critical patients. So across the country, this is part of what we are doing. The only two units who are at this point in time able to ventilate patients are Carl Kushner, I believe Belmopan, and the private sector, which is basically Belize Healthcare Partners and Belize Medical Associates. So that's the scenario in regards to admissions. What we've been seeing is that, for example, if you go back to the first slide, the presentation I did about 2 weeks ago, it's basically targeting what we're talking about, the course of the illness. And by course of illness, everyone is talking about when you become infected or exposed. Of course, you have to become exposed because you've been in contact with a person who has been showing symptoms, or someone who has been asymptomatic and has a high viral load. And by viral load means that the person has millions of viruses circulating within his body at that moment in time. When you at that point come in contact with him, because you're not taking all the public health measures as we request, meaning you're not wearing a face mask, you're not practicing social and physical distancing, and by this mean that particular 6 feet distance, you're not washing your hands consistently, or the person is coughing and he's not exercising what we call cough etiquette. So, and even so, being within that closeness of I believe someone used to call it 30 feet or something like that, no? That's 6 feet. So not exercising that social distance, physical distancing puts you at risk. So once you're exposed, there's a what you call an incubation period of 2 to 12 days, and an average of 5. So within that 5 days, you may start developing symptoms. It's like you come in contact with a person who has a flu, and you go home, and within 2 days you start with all the fever, the cough, the feeling bad, the headache, the sore throat. So this is basically what happens. So you have a window period, and that particular window period of 48 to 72 hours when you start getting sick, that's already your day 5. So at that point in time, when you start, what you call it, you have a mild illness, just a fever, the cough, the sore throat, and it's where you need assistance. You start taking your fever, your Tylenol, your ibuprofen, your cough medicine if you develop a cough. Some of the other symptoms may appear. The muscle pain, the joint pain, rash, the difficulty in breathing. So when at that point in time that you start to develop the cough, and you're seeing that the cough is not allowing you to breathe properly, or that you walk a short distance, you take a shower, and you feel weak, tired, dehydrated, you have severe headaches or back pain, and that shortness of breath or chest pain, and that is basically signaling, hey, there's something wrong. And that goes right into the 7-day period. So the point of concern is that point in time, and that's where most of our patients within the community are not seeking assistance in a timely manner. So at day 7 to day 12, or around that period is the complicated scenario when you move from what you call a mild disease to a moderate disease. And at this point in time, you're also seeing that for example, your oxygen levels, which is the trigger, which is what we're looking for, begins to decrease. Your respiration goes up. You start breathing faster and faster and shallower and more shallower because you need that oxygen. You start getting tired, weak, and coughing. So that by itself is telling you that you have a point in time that you have a high viral load. And so you have millions and millions of viruses.
And Doctor, sorry to interrupt. I just wanted to ask if these the information that you're presenting right now in terms of the onset of certain symptoms and the specific symptoms that you've described just now, that's all based on the direct information that has come out of the health system, whether it be from the ministry or from the private sector?
Well, this is actually apart from what we are seeing, and also from what the literature is telling us out there. I mean, the evidence that we used, these slides were not from the military. These slides I got them from various websites, PAHO, and other entities, universities that are over the what for us started March 23rd, somewhere around there. You're looking into what 19 months now. So it's evidence that has been there. We have accumulated within the last 19 months. What our own experiences that we are seeing is that, for example, many of our patients that are coming to us, and I say this because I visit the units. I don't sit in my office too many days. I move from Corozal to the other districts, looking at the patients and asking my colleagues, the internists, the doctors, looking at X-rays, looking at the patients. So I'm in touch with what is happening in the field.
Dr. Morey, is there any difference in terms of the COVID-19 viral shedding timeline? Any difference that we've seen between the original strain of the virus versus the Delta variants and emerging variants?
Well, certainly, what we saw is that in June, somewhere May, June, when we started seeing the amount of cases coming into being diagnosed on a daily basis, and the severity, and by this I mean how fast these persons were coming into our facilities and getting hospitalized. You were looking at a matter of 48, 72 hours that these persons needed hospitalization. And so that by itself, you were looking at something that was much more infectious. The number of persons who were testing positive in a household was also signal this is not normal. This is not what we were seeing last year when we started with the first wave. And if you may consider for us the first wave was 1 or 2 cases that we saw, or a couple of them, and then I think we went to 18. And then we had a period of up to 51 or 52 days, somewhere around that, we didn't have a case. Yeah. And then in July, August, we started seeing this next wave, and the amount of patients who were being diagnosed suddenly was 2 or 3 in a household with the Delta variant. And when it came with the third wave, which happened somewhere around June, we started seeing persons in a household being much more numbers in a household presenting with the same disease. So the previous one, you would have 1 positive, and you have 5 members in a house, you would only have 1 person positive. As of June to now, what we saw is that you have 5 persons, 4 of them were positive, or all of them were positive. So that by itself triggered something. It's not normal. That's where we began to suspect that there had variants were already in the country. And as you know, we've had, the Gamma, the Alpha, the Delta, Epsilon, they are all in the countries since May or previously. I mean, there was a backlog in us getting the reports, and certainly that's something to have in mind. Nonetheless, the amount of persons who are testing positive, if you note, within the last, as of June to now, we went up as far as 400 plus cases in a day. Over the past couple of days, what I've been seeing is that it has come down to maybe half that amount, and that might be something that is telling us, look, we're reaching our peak of this third wave. We're doing good. Nonetheless, it doesn't mean that we need to let down our guards. It doesn't mean that we don't need to continue vaccinating our population. It doesn't mean that we need to continue partying and having not practicing all the public health measures that we request from the Ministry of Health.
And when we speak about the more serious cases and hospitalizations, have the variants that is also had any bearing on the demographics affected in terms of things like gender or location in the country?
Well, if we move back in time, this second wave started in the northern part of the country, Orange Walk, Corozal, and then it began moving within the last couple of months farther into the country. But nonetheless, we still had various isolated cases, and then we began a community spread across the country. If you note that, for example, many of those who passed away last year, I think from March last year, I think Mr. Pipersburg was the first casualty, if I recall, and then up to the ending of December 31st, we almost had 320 something deaths. As of March to now, we've had almost 200. So I think we're somewhere 509 deaths within the last from the pandemic started. However, as of June to July, and in the presentation, there's one of the last slides where there's a graph with numbers. We're seeing that the amount of persons who were hospitalized or persons who were passing away last year, June, July, August, September, have been doubled or almost tripled within the last 6 months. When we compare this, the introduction of the Delta and the variants compared to the let's call it normal variant from last year, if you want to use that terminology.
What we see in slide number 9, as it relates to hospitalization by sex and comorbidity, we see that the majority of persons who become hospitalized due to COVID-19, their underlying conditions are recorded as hypertension and diabetes. These are the number one factors, number one and number two, listed in terms of why persons end up in the hospital due to COVID-19. Can you speak to that data a bit?
Yeah, certainly. What we have is that, for example, in Belize, we know that there's a high number of persons who, an unknown number of persons, and I will use that term, because we don't have what we call the incidence, the true incidence and the true prevalence of how many diabetics we have in the country. What we do know is that the number of persons who are passing away are within these two diseases. And by that, I mean that, for example, the northern part of the country, Belize, has, when we did the kidney research that we did with Taiwan, 2018, 2019, we saw that the females in the Orange Walk and Coral districts were of short stature. They were overweight and obese. Diabetes was one of the most the significant diseases of concern. And along with diabetes, if you're obese, you have a diet that is not conducive to good health, high salt, you don't exercise, you develop high blood pressure. Some of these patients, as you said, diabetes destroys everything. Diabetes destroys your kidneys, it destroys your heart, it destroys your brain, it destroys all the different sizes of blood vessels. And so it takes you down that path of kidney failure. And as when you start with kidney failure, one of the scenarios is that your blood pressure starts to increase. And so diabetes and high blood pressure go hand in hand. And what we saw is that these persons who have these two diseases most certainly are out of control. And by that I mean their numbers are not within what you want. A diabetic person, you want that person to have a blood sugar of 100 to 140, 130 regularly on a daily basis. You want to have that he has an HbA1c, which is another test that tells you an average of a 3 months period of how your blood sugar level is, less than 6.5 or within that number. A hypertensive person, that he has his blood pressure less than 140 and 80 and somewhere around that number. And so it's controlled. But what we're seeing is that these persons, one, they have not been accessing services regularly. And so you may have hundreds of persons who are diabetics out there and don't know they're diabetics because they don't realize that the symptoms that they have are of this disease. 95 to, let's say, maybe 99% of persons, more than 90% of persons who have high blood pressure don't even know they have high blood pressure. And so you have persons who are walking out of the street, obese, diabetic, would have high blood pressure of of 150 or 100, and that's out of control completely, has never received treatment, and then come into your facility, and they already have some level of damage induced by both these diseases. So what COVID does is produces a dysregulation of all what, or worsening of what is already there, meaning that the diabetes has damaged how the blood vessels function, how they open and close, how the pancreas functions, how the kidney functions. And so what it does, it worsens the disease within a person who's already decompensated for years. And that's where we're seeing the highest numbers of persons passing away. Right. And then by itself, the health-seeking behavior in males to females is historical. Males don't like going to see the physician or a doctor. They don't like going to go. Sorry, and also they fear for needles. Some of them, big 300-pound man or 5 feet 11 inches straight for one needle. So all those things are on the mentality of, well, I'm a man. I'm supposed to provide for my family. I'm not sick. Those are some ideas that pass through the person's mind. Yeah. And so what we saw is that the deaths began to move eventually.
And the data in slide 18 reveals that the majority of those persons who have died from COVID-19 to date are men. In fact, males make up for 61, almost 62% of those persons who have died of COVID-19. Does information like this ever shock you?
Well, certainly it does. I mean, what we're also cognizant is that, for example, 1% may not be significant to many persons out there. I mean, for example, with tuberculosis and HIV, the amount of deaths seen in males compared to females is double, triple. So 1% for us might not be significant, but when you tally the numbers, it is of a concern. I mean, it's just telling you that females by themselves have a higher health-seeking behavior than males. Males have a tendency to not be taking their medications compared to females. So the trends and the practices of our citizens in the male population is one of the main factors that allows them for them to come into facilities much more decompensated compared to females.
No.
And does that also have any correlation with the sorts of comorbidities that perhaps do we see higher incidences of that or a disparity between the genders?
Necessarily, in certain disease, yes. I mean, the disease, the outcome of how the disease presents itself in male in regards to high blood pressure and diabetes is much more aggressive. It's out of control for various reasons. Like I said, I mean, males, well, not. I mean, the seeking behavior is one of the biggest things, and not taking medications is one of the another scenario that contributes to these persons arriving at our facilities, and especially with the Delta variant, which produces liver kidney failure, lung damage within 48 to 72 hours. We're seeing that persons reach in shock. They have severe respiratory compromise, and once these organs start to fail or are affected, then that person goes downhill farther or worsens much more easier compared to others who come in with at an earlier time in disease, and we're able to assist them much more compared to these who are already come very sick.
Slide 20 shows that the highest numbers of deaths come from the Carl Huchner Memorial Hospital. Is there any reasons related to why more people die at the KHMH from COVID-19?
Well, certainly, Carl Huchner is our only tertiary referral hospital. Last year, within last year and up to now, most of our critical cases were being referred to Carl Huchner. You see, those who are referred are those who are critically ill and severely ill, or those who will have the potential that you identify. Because our clinicians, we try to train our clinicians in the districts. And because if you notice, PG doesn't have a machine, a ventilator. There's no capacity to ventilate a person down there.
Yeah.
So what we try to do is, even if you're with oxygen, we were using 3-4 tons of oxygen, giving patients 15 liters of oxygen per minute. And so a patient by himself was using these 100 tons of oxygen, 3 to 4 of these in a day. And so by that, it means that the lung compromise is severe. So that patient, and if he's breathing at 35, 40 times per minute, that person can't stay in PG. So he moves. We move into Dangrega and ultimately Carlution, because the outcome of this person by itself is he's consuming 3 or 4 tons of oxygen. It means he's already moving on within the clinical course of disease. He's becoming moderately and critically ill and potential to become severely ill and needing ventilation. So what the numbers of Carlution also reflects the number of persons who are being referred from the district hospitals. And also primarily those who need much more care, because I'll be honest with you, these persons, individuals who are moderately affected, they need a lot of time. They need a physician or a nurse to be consistently checking them like every 4 hours, every 6 hours. It's time consuming. Some of these patients, you ask them to lie down face down for them what you call proning, for that oxygen to expand. We've had the cases who are also needed to be put on a ventilator, assisted respiration. So all these cases are what we refer from the districts, and then the numbers from the Belize district that what you've seen in the last, as of June, the outbreak of pandemic in the Belize district per se.
And Doctor, just because we're running out of time very quickly, just before we close off, I just wanted to get a little bit of your to highlight a little bit about the effect of the Delta variant, and we see that in slide, I believe it's number 23, we can see the significant increase in infections and other things. So can you speak just a little bit about that before we close? What we saw based on the impact of the Delta?
Yeah, so we may make reference to 2 slides. There's one with numbers and another a line graph.
Yeah.
I think it comes after this. So what we saw is that if you notice within the months of June, somewhere around there, when we had community spread as of March, when the numbers went down in March of this year, we started seeing isolated cases countrywide, small community spread or clusters continuously. So I believe we were all concerned of, I think, opening of the airports and border jumpers continued, or allowing persons to go across the border and for various reasons. And then we started seeing the number of cases started spiking up. If you notice, some of these numbers coincide with various Belize City South sites starting to have cases, and the number of cases went up exponentially, very, very fast. We saw that certain villages in the southern part of the country, when we had to close down villages, set down, put police guards within that areas. I think it was Sunday Wood, and I don't recall the number of the villages, but I was all in those villages. We had to do our groundwork. And looking for points of control. So we started seeing the numbers going up, and they spread quickly from village to village, and the numbers from within the various communities. So part of that, we started seeing the numbers going up very fast. So if you notice that I think we started in March of this year with sorting about 12 to 14,000 cases, and we are already way up to 26,000 plus positive cases. Mm-hmm. So within the last 6 months, we've gone from, I think, almost 8,000 plus number of cases have been identified within a few months.
Wow.
So that's good. And if you go back to the next slide, you'll see the number of persons who have passed away or admitted in our facilities.
Let me just ask one final question as we quickly run out of time. looking now ahead, the next few weeks that we have left in 2021, and you being able to crunch the data, are you seeing that we are now trending downwards in terms of the positivity rate? I know that's something that the population has been looking at, considering the fact that the government and the health experts seem to be using the positivity rate as a gauge to determine the measures that will be implemented. Do we see a trend downward?
Yeah, I think the biggest measure that we, and let me just go off tangent here. I think the best measure that we can do as a community is the personal conscious measure of knowing that, look, we're in a pandemic, you need to exercise due care with your health and with those of your family, primarily because you're out there, you're still taking the disease, the infection back to your household. You may have children in there, you may have persons who have diabetes, high blood pressure, kidney failure, HIV, AIDS, tuberculosis, and other diseases of concern, and cancer. So there's, if you notice, there's a big gap continuously in regards to the implementation of key measures.
Yeah.
Because how many of times we've had curfew, and yet you have persons partying out late hours of the night.
Right.
How many of these persons were arrested, and I'm not sure what was done with them, if they were fined or they spent time in jail. That's unknown to me. But if nonetheless, if this type of behavior continues, and we won't be getting rid of COVID right now. The numbers can go down as much as you want into what you call the rho, or the rate of transmission, or the rate of infection. And I think we're still somewhat above 1. I haven't seen the latest data as of today, but I think we're still above 1, which is actively telling that you still have community transmission. As in regards to what you're referring to, we're seeing that the numbers are decreasing. Nonetheless, that doesn't mean that we're out of the woods as yet. We're still in the danger period. We're still seeing critical cases. We're still seeing persons being hospitalized. And if you notice, the number of hospitalization has gone down. Because I get daily reports at 6 o'clock in the morning, reports start coming in by WhatsApp to my phone. And at 9 at night, sometimes 10 o'clock at night, the latest report comes in regards to how many persons are hospitalized. Don't let that be a sign that we're doing well.
Yeah.
That we still don't heed and continue to exercise due care as to exercising public health measures.
Well, I think, and Doctor, I think that is a good note to close the discussion on, and we are absolutely out of time, so we do have to end it there. But thank you very much for coming in and sharing some of those numbers with us. We really appreciate it.
Thank you.
All right.
Have a good day.
And please stay safe as well. But with that, we are going to be taking a short break, and when we come back, we're going to be learning all about a new NGO. So please stay tuned, and we'll be right back.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.